Okay, Kirsten. So I went ahead and hit the record button. And like I was saying that, you were nominated by the campus manager as just one of those success stories on the Pasco campus. And so thank you for taking the time to meet with me today. So I did hear the good news is that you were hired after completing your program. Do you want to tell me a little bit about where you're going to be working?
So I applied on Indeed to New West Medical, and they're like a contracting company that goes through Cadlick. So I'll be working in various Cadlick clinics until I find the right one for me, and then I'll stay there.
Okay, so you want to kind of find that right fit for you, personality and, skill set. And, sometimes it's like also the clinics that fast paced versus a little bit slower methodically, and what
Yeah.
that looks like. Do you have a specific type of clinic you're wanting to work at?
No, I don't have any specific kind really.
So not like pediatrics versus, family medicine or anything like that?
I mean, when I did my externship, I was in a really small clinic, so it was kind of slower paced, but small, and I liked that. So I would like something like that, but I'm also not super picky. So
You're open. You're open to ideas.
yes.
I love it. Well, again, congratulations. That's super exciting.
Thank you.
So kind of what led you to enrolling at charter college?
So I was having a hard time in life, and I knew I needed to get a career under my belt before it was too late. So I was kind of just like looking for a CNA class originally, and then I kind of stumbled upon Charter College scrolling through Google. And I'm like, okay, I'll give it a shot. And I don't remember who called me exactly, but they had me convinced to go to Charter College in like 5 minutes of being on the phone with them. And I'm like so glad I did though.
What would you say is was your favorite kind of aspect of attending charter college?
Probably the hands-on. I'm a big hands-on learner, so the fact that they had open labs and teachers who were willing to sit next to you and help you understand things better was probably the best thing.
And with the program that you attended, what would you say, like, did you have support from others outside of the walls of charter college?
Um, I didn't have much. I had my husband and my daughter and only one friend, really, and that was about it.
And how about within the campus and, in the labs and in the classrooms, did you feel like you had the support to be successful?
I did. I did. I really truly felt like they were really pushing me and trying to help me understand and learn the way I should be.
Good, good. I think that's the biggest part of attending a smaller um, college is just being able to have some more of that, the hands-on, but also the support and, almost like everybody knows your name and being able, to ask for help when needed, I think is another key component as well.
Hmm.
So you were saying you had a little bit of, hard times and difficulties, before attending charter college, and how has attending charter college kind of changed that? Has things improved since attending charter college, or are things in a better life, limelight for you now?
Things are better now. Yeah. We're actually getting ready to move into an apartment here
Oh,
soon.
awesome. So you found an
So,
apartment for you and your husband and your daughter.
yes.
Okay, that's good. So prior to that, prior to, finding the apartment and what have you, were you staying with your friend then?
So we're kind of couch hopping, but we're also in our really hard times, we are staying in a tent. Um, at Howard Amen, or there was one time we slept in West Richland under that main bridge in our tent.
Wow. So
Yeah,
you went through some hardship and still got up and still went to school and still attended your labs and your classes and, making things work. What pushed you and prompted you to continue going to school?
my daughter. I wanted her to have the best life she could possibly have. And in that time, I had done the hardest thing, which was to let my best friend's parents have my daughter stay with them while we were going through our hardship, which was hard because, of course, I want my daughter with me all the time, but I would rather her be in a bed and with a roof over her head rather than, you know, outside in the cold or something like that.
Right. So while mom and dad are struggling, making sure that, baby girl is warm and safe, and you guys are doing what you need to do so that in the future that she's going to have a better life.
Correct, yeah.
That's amazing. That's overcoming, difficulties and hardships and, making certain that in the future that she's going to have a better life, and that, when she gets older and she's going to school and, having the clothes and the backpacks and all of those type of things. And so now, having an apartment and a new career, things are definitely changing around for you.
They really are, and I'm so thankful.
That is so exciting. I bet you are just feeling all the excitement and looking forward to starting work, and that's coming up pretty soon, right?
Yeah, I'm gonna be starting September 12th.
Right around the corner.
Mm-hmm.
Yeah. How neat is that? So what would you say, just kind of talking through all that hardship and overcoming all this difficulties, how would you say, your decision to further your education has impacted you and your family?
It showed me that I was stronger than I really thought I was, mentally. And it showed my daughter, even though you're going through some of the roughest points in your life, you can still push through and make your life successful.
That's awesome. So how old is your daughter?
She is 3.
She's 3, so she's a little one.
Mm-hmm.
Yeah. So before you know it, she will be in school. She'll be in kindergarten, and you'll have a career, and things are looking up, and that'll be awesome. You'll look back on it one day going, oh my gosh, all the things that we overcame, and, we did it together, and that's just going to be
Yeah.
amazing.
My husband and I probably have one of the strongest marriages because of everything we've gone through.
Yeah. It sounds like you guys have a pretty strong bond.
Yeah, we've known each other since middle school.
That's a long time.
Mm-hmm.
Would you say that did you meet people or did you build connections or relationships through charter college that helped you kind of get through some of those difficulties as well?
Like classmates?
Classmates or faculty members or, academic advisors?
Yeah. I mean, meeting Angela was a pretty amazing thing. And Kelly, I made a big bond with her too. And Brooke.
And those are are a couple of the instructors there on the Pasco campus, correct?
Mm-hmm.
Yeah. And then Angela is the campus manager.
Yes.
That's awesome. I love to hear that, you have the support there on the campus while you were attending. And clearly still to this day, I mean, with Angela, reaching out, just saying, what a success that you've got all the hardship that you've overcame and you've worked through it all, and that you built, that bond, and how strong you've been, to get through it all and overcome all of those obstacles and challenges that you've done. So I think everyone has applauded you, and they're just all really pulling for you to be successful, and for you and your family to do really well.
Yeah, it's pretty amazing.
So what would you tell someone, if they were looking at attending charter college, kind of, perusing Google and thinking about, CNA or thinking about a different career and they look at charter college, what advice would you give someone?
I tell them to do it. I would tell them to sign up for charter college because you will, it's a decent sized program. It's not too long. They help you with your financial aid, super easy. Um, they're there for you if you really struggle with homework or anything in your life, really. It's just a good place to go. I tell them just to do it. It's worth it.
So what is it like a day in the life? Like when you go to lab, what does it look like? Can you explain it to somebody that's like never seen the lab there on the campus? What does it look like?
So, normally on lab days, you would come into your classroom and then you would have a 2 hour span of lecture. And then you would go to the lab for the last 2 hours. And the lab was usually either right down the hallway. And you'd walk into this room, there'd be sinks and chairs. They look like phlebotomy chairs. And all your supplies and everything are on the wall and in cupboards and everything you need. Most of the time, the teachers have everything set out. And you would grab everything you need and you would have a partner and you would work on your skills that you were working on for that week in lab.
What are some of the skills that in the lab that you would do? What are your some of the fondest skills that you worked on, or that even maybe you thought were going to be challenging, but you were like, oh my gosh, I absolutely love this?
So one of the ones I knew I was going to be challenging was definitely phlebotomy, and I ended up really liking it. Brooke actually helped me do my first poke because I was so nervous, and she's like, we'll do it together. And we did it super fast, super easy. And I was like, okay, that wasn't as bad as I thought.
Is that for doing like injections or like vaccinations and what have you like that?
Yeah, injections, vaccinations, and drawing blood.
Okay. And so you actually were nervous and now you thoroughly enjoy it.
Yeah,
Go figure, right?
I know.
That's awesome. What other besides phlebotomy and injections and what other skills did you learn in the lab?
Professionalism.
Okay.
Um, Definitely, what's the word for it? I don't want to say cleanliness, but it's like staying sterile. There we go. Sterile techniques. Um, I think that's about it, other than wound care and scrubbing your arms down for a procedure and such.
Okay. And after your second mod, I was told that I think it's a completion of your second mod going into your third mod, which is like a mod is every 5 weeks, is what is kind of explained. So after you've completed like 10 weeks, going into your 15th week, you receive your uniform. Is that correct?
Yeah, I was excited. You receive your scrubs, you receive your stethoscope and your blood pressure cuff, and I was overly excited to get those because it was showing that I was making progress in school.
That's awesome. That it builds excitement, I would think.
It really does.
Yeah, kind of encourages you to continue through and step into that the professionalism aspect of it all. Right now you're wearing your uniform and you have your stethoscope and blood pressure kit and just bringing that consistently when you come to class and to lab.
Yep, it basically like forms a habit of always having that stuff on you.
Yeah, that's awesome. So tell me a little bit about, so you go through the lab, you do your classes, and then into those 10 weeks, you receive your uniform. Tell me about your last 5 weeks. So I'm understanding your last 5 weeks, you're doing it at an externship or at like a clinic offsite. Tell me about that a little bit.
So it's basically like working a real job. You go out to the site that you're assigned at. It's normally it's like a 8 to 5, or sometimes it's longer depending on the clinic you're in. And you practice all your skills that you've learned in school. You're interacting with patients, you're learning administrative work right there on the site, what it would be like if it was your job. There's just so many new experiences working out on externship for 5 weeks. 180 hours. It's a lot of work, but it's worth it.
You learn a lot. You take all those skills that you learned, in those 8 months, and then now you're applying it, in a real life setting.
Yeah. And I was nervous my first day. So nervous.
I think everyone is. Everyone that I talk to anyhow, they say that they're nervous their first day, but then they really own it. They learn kind of the routine, and by the time that they're, in their second, third week, they're like, oh my gosh, I really like this. And then before you know it, you're like in your 5th week and you're wrapping up and you're like, oh my gosh, I'm like done with my program.
Yeah, it goes by quick.
It flies.
It just blows my mind how fast, everything came down to the line, your 5 weeks, and then next thing you know, you're graduating and you're not doing the program anymore, and you're out there and you're doing your own thing.
Yeah, like you're going to be starting work on the 12th, and exciting times, moving into an apartment. So, I mean, with all of this, where would you like to see yourself in a year or 5 years now?
I definitely would like to see myself in a clinic, stable, with a good pay and stable at home living situation, and just happy overall.
Yeah, I think that's what everybody wants, right? Everybody wants to have a happy ending, a happy life, and just enjoying what they do. I think that's the biggest thing, is having passion for what you do day in and day out. And I think those, the students that I see and that I meet with thoroughly enjoyed the program that they went through, and thoroughly enjoyed, working, in the environment and the setting that they went to school for. So I'm really excited for you to get started.
I am very excited. I'm ready to start working. I'm ready to start building my life,
Yeah.
because it's been hard.
Well, you
Very
definitely
hard.
you've overcome all those obstacles and all those challenges. And it's just a delight to be able to sit here and meet with you today. And I mean, I can definitely tell that you have the passion for life and for, working in the medical field. Is there anything else that you would like to share, with anybody that was watching this? Any advice that you'd like to give out there today?
I have to say, one piece of advice I would give to somebody is, if they're going through something similar or maybe even worse, you can do it. You really have to push and keep going, but keep a positive mindset and you'll make it. It's really true when they say hard work, makes everything.
Yeah, hard work pays off in the end. And clearly it did for you, which is amazing. Yeah. Well, Kirsten, congratulations again. I'm so excited for you. I'm excited for your future and that of your families, and looking forward to hearing more. And I'll have to follow up with you. We'll have to follow up with you and see how work goes and what clinic you end up with or you choose at Cadlick. And, the best of luck to you.
Thank you.